These days, radiation is used to treat most types of cancers. The most common cancers we treat are going to be lung cancers and breast cancers, prostate cancer, head and neck cancers. We also use it for a variety of gastrointestinal cancers, including rectal cancers and stomach cancers, pancreatic cancer. So the list just goes on and on. We even use it now for treating some benign conditions, meningiomas in the brain, trigeminal neuralgia, which is a very painful condition that affects one of the cranial nerves. So a wide range of different applications for radiation. In general, the frequency of radiation is a daily type of treatment. So depends very much on the disease site. So for example, when we treat a breast cancer, typically that's between 4 and 6 weeks of daily treatments, once a day, Monday through Friday. When I treat prostate cancers, typically that's a 9-week course or close to that, 44 treatments of Monday through Friday treatments. Lung cancers are more in the 6 to 7 week range, so 30 to 35 treatments and so forth. When we're treating things for palliation, that is for patients who have pain that we're just trying to control, we might treat in as few as a single treatment, or we might do somewhere in the 5 to 10 treatment range. These days also we can do something called stereotactic radiation, where we do a very high dose of focused radiation at a very small area, and for that we typically treat between 1 and 5 treatments. The side effects of radiation therapy vary greatly according to the area of the body that's being treated, and also the dose that we're treating to. So for example, if I'm treating a lung cancer patient where the chest is the main area that's getting treated, we may have some impact on the skin. You can notice, especially as you get toward the end of a treatment course, that patients may have what looks like a bad sunburn. In that area also, you can have the esophagus getting some radiation, so a sore throat is fairly common. You can also find that there are some issues with breathing itself because the lung gets, in some cases, a fair amount of radiation. If I'm treating somewhere in the pelvis, for example, a prostate cancer or rectal cancer, something like that, diarrhea is fairly common. Issues with urination can be common, that is burning with urination, increased urinary frequency, and other things like that. If we're treating in the head, for example, fatigue is very common, loss of hair, and skin reaction, again, quite common as well. In terms of long-term risks, again, very dependent on the part of the body that's being treated. So, for example, if we're treating the head, we worry about long-term issues with memory and mental functioning. The higher the dose and the greater volume of brain that's being treated, the higher the risk is that you're going to have long-term side effects from that. When treating the chest, we worry a lot about the lung, and the more of the normal lung that gets treated in treatment of lung cancer or another cancer in the chest, the higher the risk is of things like long-term shortness of breath and exercise intolerance. If we're treating down in the pelvis, we may have issues with looser bowel movements, bleeding with bowel movements, and so forth.